So here
No,
we
we're
are.
not quite there
Oh,
yet.
right.
Wait till it stops spinning. Although it was.
Yeah. I'll just introduce us, shall I? Yeah, like you said.
Okay, we're live.
It's counting down.
No, it's
Oh
counting.
no, hello and good afternoon. So here we all are in Witney, and a very big welcome. We are a small portion of what is a very nice big team, and today in the office we have Joe Allen.
Hello.
We've got Ruth.
Hello.
I've forgotten your surname.
Richards.
So this is what doing this does to us. It makes us forget our own names. And I'm Claire Smith. And we're just going to give you a brief overview of pregnancy wellbeing. And if we have time, we'd like to touch on the latent phase of labour and a little bit of information about the TENS machine and what that can do for you in regard to pain relief. We're really happy to take your questions, and we hope to have a really good interactive afternoon with you over this 60-minute period. So take it away, Ruth.
Okay, so the first point to think about for pregnancy well-being is your nutrition, and you need to aim to promote the optimum outcome for mother and baby. So it's a really good idea, even before pregnancy, to look at preconception diet and have a well-balanced diet, which includes things like fruit, vegetables, pasta, rice, potatoes, fish, cheese, yogurts, things like that. You can find all this information on the OUH maternity pages and NHS websites for diet in pregnancy for pregnant women. It's quite important to try and reduce your BMI if you're slightly over the recommended weight. A healthy BMI for a pregnant woman, we say is between 20 and 25. Although some women sit quite comfortably at around 28, things like that. But if you can reduce it a little bit, if it is higher than that, then that's a really good thing to do to start your pregnancy. And this will also help to reduce the risk of gestational diabetes. Also, things like undereating isn't a good idea. You do need to ensure that you're getting enough calories to support your own body and that of the growing fetus. So it's a balanced diet. You don't need to be overnourished. You don't need to be undernourished. Also, we do recommend that you look at adding some vitamins into your diet. For example, folic acid, which is to help to develop the baby's spinal cord during pregnancy. And that's 400 micrograms. And you will need to increase that to 5 milligrams if your BMI is raised. But your midwife can guide you on that as well. And also vitamin D is important because, obviously this year we haven't been away because of COVID, so not many of us have had much sunshine, but we normally recommend a 400 international unit dose of vitamin D, and if your BMI is raised, then that increases to 1,000 international units. Other things to mention are foods to avoid, and that's things like some cheeses that are naturally ripened, like brie, camembert and Stilton. You can find some pasteurised brie if you look in some supermarkets. And really what you need to be looking for are things like listeria, which is a bacteria that can be in some foods that are non-pasteurised, and they are sometimes found in blue vein cheeses. You can have soft cheese as long as it's heat treated or pasteurised. So things like Boursin, Dairy, things like that you may enjoy are still fine. Philadelphia, that they're still absolutely fine. with eggs, you need to be looking for the red lion stamp on your egg, because they are fine cooked slightly under. So you can still have your runny eggs with your soldiers if you do enjoy that for breakfast or lunch or whatever. And things like making sure you wash your hands, wash salads, and the storage of cooked and uncooked foods, just make sure you're doing that properly. Things like, you know, freezing things and storing things in your fridge. Also, something to note is if you do have cats or kittens, the litter tray can be something that you might have to get your partner to clean if you've got a cat, because it can cause an infection in pregnancy called toxoplasmosis, which obviously we want to avoid. And things like washing the soil off vegetables if you grow your own in your allotment or anything like that, or in your garden, which people have been doing more of this year.
And visiting farms as well when it's the lambing season. That's another risky area for people in pregnancy.
Yeah. So moving on now to things like alcohol consumption. So during preconception, we try to ensure that women reduce or stop drinking alcohol, just to get your body into a really good healthy state. And we don't recommend alcohol once you've conceived, because it can cause fetal alcohol syndrome, which can cause problems with your baby. So we say do not drink alcohol during pregnancy. Things like smoking, try to stop smoking if possible, because obviously there are nasty chemicals in cigarette smoke that, you know, we don't think are a good idea for a growing fetus. You need to have fresh air and lots of oxygen pumping around your body, and not these nasty chemicals. So if you're a smoker, then you can refer yourself online to smoking cessation, or see a nurse at the surgery to help you to stop, and she can give you patches and different types of help to get you non-smoking before pregnancy or during pregnancy. There are dangers of passive smoking as well for pregnant women and any other, any other people. So if you're with a family that smokes, then it might be a good time now to discuss maybe the family stopping smoking, or if they do have to smoke, then smoke outside the house. We recommend sometimes wearing a smoking jacket, taking the jacket off, washing hands, brushing teeth, really having a shower and changing clothes before baby cuddles and things once the baby arrives. We have been recently testing all pregnant women for carbon monoxide poisoning, and that can be found in faulty boilers. So at the moment we're not doing that test due to COVID and obviously blowing into a machine. So you know, it's just something to be aware of, that your boiler's okay and your carbon monoxide alarm is fit and working. And obviously some people do smoke other types of things like hash, marijuana, things like that. That's obviously not recommended in before pregnancy and during pregnancy as well. I'm just wondering if Jo would like to talk a little bit maybe about exercise, perhaps?
Yes, of course. So during pregnancy, we do recommend that you continue with your exercise regime, and in fact plan to exercise around about 150 minutes a week. So that's 10 minutes, or did they say 20 minutes? 3 times.
Anyway, 3-4 times a week,
yeah,
I think,
is
just
then
a brisk activity that raises your heart rate
for longer than 10 minutes when you do it, and then to work up to about 150 minutes a week. And the idea is obviously to raise your heart rate, to keep your muscles active in your body during the pregnancy, and we know that this can help you to sustain your body during the pregnancy time, to reduce aches and pains, and it also helps to keep your muscles nice and toned, which can be beneficial during labour as well. We do advise, obviously, there are certain things in pregnancy that can be a problem. As you've got greater progesterone in your body, you are more prone to some injuries. So you need to be very aware of how your body is reacting to any exercise, and listen to your body very carefully when you are doing exercise. So if you're increasing your exercise in a dramatic way, if you've been off your exercise for a while because of sickness or something like that, and then going back to it, it's important to build it up again gradually. And very important to not bump the bump. So do any contact sports and things like that could create an actual impact onto your bump is obviously not recommended. But with COVID, obviously we've had many fewer activities going on as a joint classes and things like that. But it's very nice to join into those social groups with other pregnant mums if they are around, either by Zoom, if we haven't got back into that, or indeed other classes, but worth always telling the person that's running the class that you are pregnant. Some areas have Zoom Zumba in pregnancy, and that's something that
we're
did have
very fond
here
of that.
in Witney for a while.
Still ongoing.
But so anything like that is worth considering as well. We did have a question about early labour. I don't know if you saw that.
No.
So there's a question come in about the early starts of labour and the signs and symptoms. Shall we move on to that?
I can cover that, yes. So there's a very interesting part of labour which is called the latent phase, or early phase of labour. As you may know, labour is divided into 3 stages: the first, the second and the third stage. But predominantly the first stage is the longest stage, and it introduces something called the latent phase. And this is a really irritating and frustrating part of labour. This is when the body is niggling its way into full-blown labour, a bit of a stop-start scenario, and it's very common for women not to know what to do. So we get many calls from women and their partners to say, are we or aren't we? What should we or shouldn't we do in this situation? So let's have a little understanding about what is likely to be happening at this stage. So at the end of pregnancy, the baby is trying to negotiate a good pathway down and out so we can meet. And to do so, involves a little bit of corkscrewing, getting into a nice position. And all these late niggles and contractions, that's what they're doing. So gravity plays a huge part in all of this. Also, the cervix, which is the neck of the womb, starts to soften. You'll hear some very strange terms, always sort of food linked. It's like ripening, which I don't know why, but we often have a lot of association with food descriptions to do with pregnancy. So we talk about ripening of the cervix. This is when it softens, it starts to narrow, and there's another term called effacing, and then dilating. You may hear anecdotally that you need to get to 4 centimetres before you're considered to be in labour. That's we can't have a one-fits-all scenario. So for many women, anything between 0 and 4 centimetres fits into this early latent phase, the early part of labour. And that's what's happening. The cervix is getting prepared. So while you're experiencing these irregular contractions, which are longer lasting than your Braxton Hicks, this is quite likely to be what's happening. The body is preparing. So don't disregard it. It's not that you're having something for nothing. Our advice really is to stay at home during this early labour time. your own environment is the most comforting and likely to be helping you with your endorphins and your oxytocin, because it's where you feel safe, it's where the loved ones are likely to be, and you can get lots of hugs and massages and all the things that will keep you happy and healthy. In the latent phase, it's quite good to keep upright, to mobilise, to get exercise, but also to nourish yourself, have some warm baths. We don't want to just simply say, have a bath, take some paracetamol, get rest, because we need to understand from you what it is that's making you worried or anxious about this stage. And we're very, very happy to take your calls to talk you through this. We don't often invite you into the hospitals in the latent phase, because once you're in the hospital environment, it can tend to make us aware that things should be happening, and a tendency to perhaps medicalise what is in effect a very normal environment. So make sure you're staying at home, you're being nurtured, you're being nourished, and keeping upright and mobilising. If you're finding it a little bit too uncomfortable, there is no reason why you can't be seen. We can sit with you, we can feel your abdomen, we can start to measure by palpation or touch how these contractions feel to our touch. It's very interesting that we can actually tell you when your contraction's starting, because it starts at the top of your uterus, but women tend to only feel it as it's starting to move downwards, so it tends to feel more of a naggy period-like pain. So we can talk to you about when we feel it's working and time it accurately with you, and then we can see how long this lasts. If it's quite clear that your contractions are starting to organise, again, there is no reason why we can't examine you, but we try not to do too many intimate examinations during the early part of labour. If we talk to you over the phone and we've reassured you, but a few hours later you ring again because things have changed, again, there is no reason why we can't see you or you can't be seen at a midwifery-led unit and be assessed. No, there's no problem whatsoever to have this long conversation. There are lots and lots of alternative methods to keep you comfortable. Using your birthing ball, great for upright positions, keep moving and bouncing. Massage we've talked about. Aromatherapy, lovely, lovely, soft, smelly gorgeousness, which will help you feel in the right frame of mind. Put that together with some nice music and you're really, really on the right track to actually being in a good bubble of wellness. While you're doing that, the other aspect that is often used now is hypnotherapy or hypnobirthing, having some mindfulness, some positive thinking. It's not a bad thing. This latent phase is all good. So getting into the frame of mind of thinking, you've not started the race, but maybe with a mad analogy, you've entered the arena and you're limbering up, ready to start. So I don't know whether that started some thought processes, and I might have said something that's encountered some criticism or it's engendered some questions. Please send them through. You might see at the back of where we're sitting, we have some posters. We don't usually have posters on our wall. We're not doing that per se because of COVID. But today, because it's special, we thought we'd have some posters behind us. One of the posters you can see is talking about a pain management barometer. So it starts nicely on my left, saying about a warm bath. It talks about the TENS machine, which we'll come on to, injections and pools for warmth. Wonderful idea. And then it goes on to the other side, talking about what I've been mentioning, the self-help techniques, the massage, the hypnosis, movements and supports, and positivity and oxytocin from your partners and loved ones. Going on to gas and air, which is an inhalation and analgesia, and then the big guns such as the epidural. We talk on our green poster about oxytocin, which is released when you're aroused, orgasmic, the hormone of love, and stimulates the flow of breast milk and triggers the care and behaviour in parents. And it also helps the womb to contract and makes your contractions regular and effective. And we all hope that we're going to get some good endomorphins and endorphins, which will help with your natural painkillers. They are great, and we want those to be aroused. And adrenaline is a bit of the bad guy. Adrenaline happens when we're frightened, and it's our fight and flight. So when you come into hospital, that can knock off all of these positive endorphins. So we often say that wait in the car until you're invited in, so you're still in the right environment in your nurtured little car. So I'm going to stop for a moment, see if there's any questions, and then one of my friends here will talk to you about the TENS machine.
So you may have heard about the TENS machine. It's a very useful tool, especially in the latent phase of labour, and it's something that you can hire privately from a number of different outlets. They usually allow you to take the TENS machine from about 38 weeks, and you keep it obviously until you've had the baby. So if you are having the latent phase of labour and it's going on a little bit at home, or indeed in early labour, it's useful to put the TENS machine on, as it starts to increase all your natural pain relieving hormones and help those to develop through the labour. This is a standard machine here we have, and so we've got the device that is the controller that you adjust according to where you are in the labour. So you might start with having it on quite low, and then as you move through the labour you can turn it up a little bit. It sends little electrical impulses down the tubes to the sticky pads that are positioned on the back as such. Thank you, Ruth and Claire.
Turn a little bit. Turn
The other way, that's it. So one fairly low and the other one around about the bra strap area, and the device sends electrical stimuli down the tubes to these pads, where you will receive a little tingling sensation. If it's on very low, then the tingling is just there in the background, and then you have generally a pulse button, which it says boost on the side here. Some of them have a little device that you press the pulse, and if you press that when you're having a contraction, it gives more of a continuous stimulus. As I say, through the labour, if you nudge it up a little bit, it gives more power as the contractions get a little bit stronger. It is one of the sort of natural pain relieving methods that is very highly researched and we know to have very good effect, and some of you will also know that it's used in other forms of healthcare as well, with other back pains and problems. So it's definitely something worth considering. We're not hiring them out from the hospital at the moment, or indeed using them in the hospital for COVID reasons, but you can hire them yourselves, and as I mentioned, it is better if you put them on earlier in pregnancy, probably before you come in anyway, in order to get those natural endorphins going. Is there anything else we need to say about
this machine? Is the Mama TENS one. I think if you just Googled Mama TENS, you'd probably find the information that you wanted. But I think you can get these in sort of any good chemist. You can buy them, or you can hire them. They do that as well.
If you do buy them, just make sure you get the obstetric TENS machine, not a standard TENS machine, which would only normally have 2 pads. So the obstetric one has the 4. And is quite specific.
And obviously when you're in labour, there's certain times when you can't use it, so you can't use it in the pool. Sometimes it interferes with some of the monitoring, so you need to be aware of that.
It can also go on and off during the labour, so you know, if you're at home and you've got the TENS machine on but then you want to have a shower, you can take it off and put it back on again, and the sticky pads tend to work quite well with that, and some people will use a bit of micropore to pop it back on afterwards if need be.
And one word of warning, please turn it off if you've asked one of us to take it off for you, because it fizzes and gives us a bit of a zizz as well.
So we have a question which is regarding the stretch and sweep. So thank you for bringing that up, Rachel. She asks, how long does a stretch and sweep take, and what do they do, and how effective is it? So we generally offer a stretch and sweep, which is an internal examination at about 41 weeks. Sometimes it's variable according to an individual, but that's the rough time that we would offer that. It's an internal examination done by your midwife, which we know is quite a natural way of stimulating the cervix to start producing the hormones which can initiate labour. So it takes, you ask how long it takes, it takes sort of 5 minutes. It can take as short, as you want it to. If you find it uncomfortable, your midwife doesn't have to continue it. It's not meant to be uncomfortable or unpleasant, but we know that it can be something that is useful and can help the body start getting into labour. We also know that if we repeat them too often, we can cause the uterus to become a bit niggly, which is not such a positive outlook. So although you may want, if you've had one stretch and sweep, you might want to have another one. Sometimes that's not always the best option. If it's going to get you into labour, it generally does that within sort of 24 to 48 hours. Anything else to say about
We don't normally recommend too many, do we? A couple really
It's
is
plenty.
It's
a very intimate examination, and it's best done in an environment where you feel comfortable. And it's the approach is a gentle one, and we always make sure that we have your consent. You don't have to have it. It's not an insistent examination.
Any other questions?
Good. A little note from Emily. She says, hi Ruth. Ruth was my midwife and she was fabulous.
Oh, thank you, Emily.
What a nice comment.
And we've got one from Paula McCann. Do you remember Paula? Paula says, enjoying seeing some of my wonderful ex-colleagues talk about labour. Hi Paula.
Thank you,
That's
Paula.
nice. Hi,
Good
Paula.
to hear from you.
Now,
shall I do a bit more on that?
Yeah, okay.
So we were earlier on in the session, we were talking about just sort of getting yourself into a healthy way of life and preparing for pregnancy and things like that. Things that you will be offered are the benefits of the flu vaccine and the whooping cough vaccine. So normally when you're first pregnant, even from your early scan, maybe up at the hospital when you're about 12 weeks pregnant, we can offer you a flu vaccine to prevent flu developing through your pregnancy. Obviously, flu can be a really nasty illness for anyone, but a pregnant woman is more susceptible with flu because it's a double compromise on the lungs. The lungs can be really compromised badly because of the pressure of the pregnancy and also having flu on top. So the flu vaccine is recommended. Also the whooping cough vaccine, which we normally tend to offer women between 20 and 38 weeks of pregnancy. We offer women that because a few years ago there was a rise in whooping cough and some babies have died of it, sadly. So now we recommend that pregnant women have the whooping cough injection so that the whooping cough crosses the placenta and builds up antibodies in the mum, and obviously baby would get a few of those antibodies so that when it's born it can actually pick up the whooping cough. Because if you remember, when babies are first born, they don't have any immunity to whooping cough until they get their first jabs at 8 weeks old. So it's something to seriously consider. It's a really good thing to have. Any other questions come up at all, or are we still the
well,
same?
we have another question on regarding actually something specific, which is gallstone pain during labour, which obviously is quite a rare and specific condition that I think, thanks for that, but it's probably better to speak to your midwife individually and probably get referred if that is something you're experiencing.
Okay.
Any other queries at the
Nothing else
moment?
at the moment.
Okay. So we'll just talk a little bit about dental care then during pregnancy, and what we normally tend to do now is that we've actually gone. We now book the FW8 form through we do it on computer as soon as we've booked a woman and given her blue notes and done all the things for pregnancy. We give her the FW8, which gives her free prescriptions and dental treatment during the whole length of the pregnancy and for 12 months afterwards.
The dental freedom is only for those ladies who are under an NHS dentist. Fortunately, it's not available for everybody wanting their free dental care. It's only if you've got an NHS dentist.
And also, just to remind you that your gums can bleed during pregnancy. It's quite common that there's a change in the dynamic of the gum, and it's something that can happen. But it's probably worth talking to your dentist if that happens.
We just got a question from Amy. Thanks, Amy, about the injections that we recommend, whooping cough and flu. She's asking, will the midwife contact you, or do you need to contact your midwife directly?
So that's a good question. So the flu vaccine, it tends to be organised via your GP surgery, so it's more of a public health situation for anybody who's considered to be in a vulnerable group. So if you are registered with a GP, then for your flu vaccine, it's probably a good idea to actually contact your GP and make sure that they've got the supplies. And generally speaking, the flu vaccination programme starts in September. Having said that, we do know that as winter progresses, that when our women go up to their scan appointments, that often there's a flu vaccinator lurking in the anteroom and will approach you and offer you your flu vaccine then. So my answer is that it's not your midwife who will vaccinate you. It's usually a member of the GP surgery, and particularly with the 20-week whooping cough vaccine, we recommend that once you're around and about the time for your anomaly scan, if you're having it, that you contact your GP surgery and book an appointment with the practice nurse.
Any other questions?
Nothing else at the moment.
Okay. So we just wanted to sort of reiterate how important it is to attend your antenatal appointments. And regular checks with a midwife have, significant, play a massive impact on the health and well-being of mother and baby. And that's why we ask you to come along and bring a urine sample. And, it's good to have a chat and have a conversation with your midwife, because it enables us to understand how you're doing, and an opportunity for us to give you further information and support as required. And also we can regularly check your blood pressure and answer any queries about baby. Also things like measuring the symphysis fundal height. So we measure the top of the uterus down to your symphysis bone and check that that's within the normal requirements of growth. And obviously things like recently we've introduced the 36-week growth scan as well, to check that baby's doing well with its growth. And also you get put onto a scan pathway depending on the need during pregnancy to be scanned a little bit more and watch the blood flow through the placenta to the baby, so that the baby's developing and getting the nutrients that it requires to grow. It's really good to develop a good rapport with your midwife if possible, that helps us to understand what you require and need from your midwife, and helps with continuity of care. Any other questions, Jo, so
I
far?
think that's a nice point to make, that we're really keen on having continuity of care with you, so you meet somebody that gets to understand and know you, and there's a breakdown in having to explain the same thing time and time again, and can work with you to plan how you want to take forward your birth journey and your place of birth, which is going to optimise the outcome, really.
Mm-hmm.
And obviously through COVID, things have been really difficult with that, for lots of reasons, with different midwives not being available, and obviously not having much face to face. But it is something that, especially in Oxfordshire, we're very keen on doing.
Yes.
We've really tried to promote the continuity, haven't we, between so that women are seeing their own midwives if possible,
or even their own little team.
Or their own team. We do put you into a team and try and keep you with 2 midwives or something.
Yeah, so if it doesn't happen, we apologise, but
Yes.
we do
We're
we
as
do try
frustrated
to.
as you are, if that's the case. We miss you.
Okay, so
yeah. The other thing that we thought would be worth to have a chat about is mental health during pregnancy, and obviously you'll know and have had your midwife asking questions about how you're feeling physically and mentally through your pregnancy, and we specifically want to investigate your mental health during your pregnancy, because we're very fully aware now that issues can arise, and most often do arise during the pregnancy period, although in the past we've focused on it more in the postnatal period after you've had the baby. So we ask you to monitor your own mental health and let us know if you feel like you're getting very low in mood on a regular basis, or if you're feeling anxious about things that maybe you weren't feeling anxious before, or if your anxiety has increased during pregnancy. It's something that we want to know about, and we want to talk to you about, and we want to give you tips and hints on how you can address it, because addressing it in the really early phases is something that is going to be most successful and most beneficial for both you and for the baby. A lot of women are concerned about how babies are affected by low mental health or poor mental health during pregnancy, and obviously we want to reassure you that to a large extent there's very little impact on the baby, but over time, if those issues get very severe and are not controlled well, then the cortisol that is rising in your body can also affect the baby, and sometimes leads to a smaller baby or an early birth. So it is worth focusing very much on that, and there are lots of things that you can do. We very much promote mindfulness now in pregnancy, and there's a great app, the Headspace app, which a lot of you will know, and they've got a pregnancy pack on there that you can access, and we have an Oxford mindfulness group as well that you'll have seen on the Maternity Voices website. We also, in all areas in the country, there's access, in sort of immediate access for people to initiate themselves. They don't have to go through their GP to get some talking therapies, and in Oxfordshire it's called Talking Space Plus, which you can find online. And most of you will have been advised about getting the Baby Buddy app, which is an NHS derived app through Best Beginnings, and has lots of useful information there as well. So We also know that one of the things that is really positive for our mental health during pregnancy is to focus on the attachment with your unborn baby, both for you and for your partner. To openly talk to your baby and imagine how your baby looks and feels. Enjoy the movements, even though sometimes they're uncomfortable, but use that time to focus on what your baby looks like, and those things we know help to increase your natural positive endorphins and hormones that also go to the baby as well. Do you have anything else to add about?
It's just to say it's okay to feel down. It's okay to be anxious. You don't have to wander into your antenatal appointment with a smile. We want to know how you really feel. So it's a mind and body balance. So we're interested equally in both areas of you.
Absolutely. If there are any questions on that more, do pop them on the chat there. We do have a question about doulas, which is basically are they allowed into the birth room as well as the birth partner? We can't speak. You ask in the near future. We can't really speak of what's going to happen as time goes on, and at the moment it is just birth partners that are allowed in the labour room. We will remind everyone to just check the OUH website to see what the current advice is on birth partners and anything related to COVID, because it's updated all the time.
And we work very well in partnership with doulas and recognise their part. So that's not a problem. It's literally just as Joe said. It's all about numbers.
Yeah, it's numbers at the moment, isn't it?
Yeah. So do we have, we've got another sort of 15 minutes that we're available if anybody has any more questions or want us to direct this live session specifically. I think we've spoken of most of the things that we wanted to. Did you mention alcohol?
Yeah.
I think we did talk about alcohol.
Is there anything else about the latent phase? That was one thing that we chatted about. I know it's something that people get really worried about, don't they? And they wonder, is it normal to?
Yeah, and that's the point. Is ask the question. Talk to us. We don't mind. That I think it's that old comment. There's no question is a silly question. If it's bothering you, then share it, voice it, and we'll listen to you.
Absolutely. And of course, having the telephone numbers to call and just
I think if we're talking about anecdotes, there's lots of advice that's given freely amongst families and friends. We don't really advise you to take lotions and potions to get yourself into labour to accelerate the latent phase. So a big curry might taste well, but it's not going to work necessarily. And all these unusual situations that you might hear about. It really is the case that your body will do the thing when it's good and ready. So we don't want you being in labour then with stomachache.
Absolutely.
Yeah, and I think what you spoke about before, Claire, about making sure that you're upright and moving around, maybe going for a walk for 15-20 minutes each day. That helps with gravity and baby coming down and pressing down on the pelvic floor and onto the cervix. Just sort of like trying to relax into it a little bit. Don't try and rush it, because it will happen. It's just sometimes it's frustrating when you're in this latent phase and waiting, and you keep getting niggles and then it goes off, and it's just managing it really.
And also you get the calls, don't you, from the family and the friends. Are you still pregnant? Are you still there? Which at first can be amusing, but after a while it's just so annoying. So I think then you put your gatekeeper onto that, and you have your person who will hopefully screen all those calls. It's a don't call us, we'll call you scenario, I think.
Yeah. Change your answer first.
Yes, change your
Not
answer.
yet.
And also probably, you know, like Claire said, being in your own home and in your own environment, you know, it's really nice to be able to make nutritious snacks that will help you through that phase. Things like, you know, scrambled egg on toast, or a nice sandwich or something, or, you know, whatever foods you fancy that have got good nutrition will help you keep your blood sugar levels up for when the labour does start. Because obviously once you get into stronger labour, you might not feel like eating too much, and sometimes you just fancy like sucking on a few sweets or something, or an ice cube.
Yeah.
So you do really need to, you know, maintain that nutrition throughout the latent phase. It keeps your body in good health, and it's stocks really for labour and birth.
Yeah, I think it's a really good point actually.
And
because
hydration, it leads on to that as well. And you know, when you're working hard, it's again goes back to the exercise link. You know, it's having a baby is equal to running a marathon. So you wouldn't go for a big run without taking in plenty of fluids. So you do need to drink. You need to keep yourself hydrated. If you choose to have, you know, a water birth or go anywhere near a pool, you've got the evaporation as well, so keep that fluid level, and make sure you keep your bladder and bowel empty as well, which is another thing we haven't touched on. So there's strange things that happen in those areas, so you might find that your bowels misbehave a little bit and are a little bit more active. All of these things are quite normal, so you look back anecdotally and think, oh gosh, that's why I was a bit more active the day before. So yes, that they all add into the picture that you can take of things changing, but in a subtle way.
Yeah, and I guess it's accepting that it's actually a normal part of the process, whereas, you know, you've been pregnant and we've been staying away from all these regular contractions or asking you to contact us, and then suddenly they're there. So it must, you know, it can be very daunting for women experiencing that.
It can be frightening.
But if you kind of acknowledge that it's a normal process, then it's going to be easier to cope with.
And using positive terms, you know, not trying to avoid things like pain. You know, it's there's surges and pains, or they're just strong, you know, tightenings, tension around your abdomen.
Well, we've had a thank you from Beatrice saying for everything we've done during those challenging times. So well done, girls.
We'll say thank you from everybody.
And I guess we'll draw it to a close. Thank you very much for listening, and we wish you all the best. And for the next live event.
Yes.
Good luck, everybody.
Yes, good luck. Bye for now.